1.
Hi everybody, I'm Katie Pitzel. I'm a clinical education specialist for the Med-Surg service line. I'm going to talk to you today about high flow nasal cannula use in adult Med-Surg patients. I'll go over some specific COVID implications as well. So, high flow nasal cannula in adult Med-Surg. Here are the concepts I'm going to go over with you. Of course, before we enter the room, we want to don PPE and enter as we would an appropriate COVID patient procedure. We're going to perform a focused respiratory assessment. We'll talk about oxygenation and ventilation, how to optimize oxygenation and ventilation in the setting of both COVID and the use of high flow nasal cannula, specifically with respiratory hygiene, positioning, O2 saturation, and easing the work of breathing. We'll talk about how we use high flow nasal cannula to prevent desaturation using the FiO2 or the air oxygen blender, and how to ease work of breathing using the flow meter. Of course, using our nursing process, we always want to reassess or escalate if we're seeing any early warning signs, and always be liberated to leverage our RT, our provider, or a code response if we need to. And then of course, we're going to talk about exiting the room, doffing PPE in a COVID state. Okay, with that, I'll walk over here and say I'm knocking on the room, knock, knock, knock. And at this point, we're going to assume that I'm donned in as appropriate to this COVID patient. So I'm entering the patient's room. Hey, Fred, my name's Katie. I'm going to be your nurse today. I see you're on the high flow nasal cannula. How are you feeling today? And of course, I'm going to be watching for his color, capillary refill. I'm going to see if he's having any exhaustion while he's breathing. And then, I'm going to look and listen. And as we know, with the PAPR and other things, it might make it hard to listen adequately to his lungs, but doing the absolute best we can to get a thorough assessment of his oxygenation and ventilation. And of course, I don't have it here, but the pulse ox is going to give me an idea of what his saturation is doing. And if it is dipping lower than I'd like it to, say like 88 or 87, first, of course, we're going to make sure it's attached to his finger. Yes, Fred, it looks like your pulse ox is adequately on your finger. And as I'm listening, let's pretend that he's starting to dip down into the 80s. As a good Med-Surg nurse, I would sit him up, I'd have him cough, deep breathe, use his incentive spirometer, all those respiratory hygiene interventions that we already do well. And then in addition to that, I'm going to look at his high flow nasal cannula, and I'm going to see what I might be able to do to increase his oxygen saturation because it appears that he's now dipping into the 80s. So when I look at the high flow nasal cannula, I might be caught off guard by all the bells and whistles, but it's actually quite simple. You have your air oxygen blender here. If it's down to 21, that's the same as room air, okay? And I might go up by like 5% if I need to adjust his oxygen saturation. And then of course I might stay, do the rest of my head to toe assessment. I might check under some of his devices for his skin to make sure it's okay, make sure none of this tubing is in the way so he doesn't fall. And then I might come back and say, okay, did me turning off the oxygen do anything to his sats? Okay, now he's starting to come up, he's in the 90s. I'm feeling pretty good about that. I'm gonna chart it, everything that I did, and then I'm going to come back and reassess shortly. Next to the air oxygen blender is the flow meter. The flow meter does just that. It pushes down flow through these pipes that are blended with humidity to the patient down their nostrils, and it's pushing positive air pressure down into the patient's lungs. Now it's different than BiPAP and CPAP where it's not a controlled pressurized situation, and so a patient on high flow nasal cannula is very appropriate on a Med-Surg unit. However, as nurses, we will partner very closely and leverage RT to control the flow rate. And there will be some care areas that the nurses will adjust flow, but for the purpose of this video, I'm going to say that respiratory will take this function over. And again, flow is to ease the work of breathing, so retractions, dyspnea, things like that. For desaturations and pulse ox, I'm going to, as a nurse, be liberated to use the oxygen blender. Okay, so let's just walk over here and make sure that we covered everything, okay? So when we enter the patient's room, we're gonna don PPE and enter as we would appropriately for a COVID positive room. We're gonna perform a really good respiratory assessment like we always do, checking for adequate oxygenation and ventilation. We're gonna optimize our oxygen and ventilation by using our respiratory hygiene interventions, positioning, sitting on the edge of the bed, coughing, deep breathing, things like that. And then using our FiO2 on the high flow nasal cannula to adjust in maybe like 5% increments to look at their oxygen. And then if their work of breathing seems to be the problem, I'm going to involve respiratory to look at the flow meter. Again, high flow nasal cannula has two different functions. The ability to saturate with oxygen, which is your FiO2, the air blender, which I pointed out, and then ease work of breathing, which is the flow meter, which again, respiratory therapist will take on. We always want to reassess any interventions we have, and we want to leverage RT, but also feel free to call an RRT, our provider, or a code response if we are starting to see early warning signs or we really feel like our patient is declining. As we exit the room, I didn't go over this through demonstration, but of course we want to, if it's an aerosolized room in our a pressurized room, we want to make sure that we're exiting that appropriately, doffing our PPE appropriately, and then always document anything that we did in the room so that we can over time see if our patient is improving. Those are sort of the highlights of high flow nasal cannula in the adult med surg patients. Thank you for your time and good luck out there.